Another thing people ask me is, did you lose sensitivity after the breast reduction? Alright, I did lose a little bit of sensitivity, but it was weighing the options out again. Do I want heavy breasts for the rest of my life? Do I want to carry these bags around when I get 60, 70 years old? No. Can I lose a little sensitivity? Yes, that's okay, because I know what it felt like all of my life. I still can feel, I have a husband, so he plays a little bit with them. I can still feel when he's playing with them. If he has his little tongue and playing with it, I can still feel a little bit, but some areas I can't. But I still get pleasure off of them. When you're in the moment, it really doesn't matter. I have so many other places that has sensitivity that, it doesn't matter. You know what I'm saying? So I lost a little bit, but I still have a little bit. I can go outside and it's cold. I remember the first couple of days after the surgery, I was kind of like, oh my God, they were kind of soft, and I was like, are they going to get hard? Am I going to feel them? And it was during the winter, so I was at work, and a cold breeze came through. Boom, they came out. I looked at my boss and said, well, they work. So they still get hard. So that part still happens. They still get hard. I can't walk out of this house with a little tank top on without a bra because my nipples do pop, and my husband would not be so happy with that. So I still have to wear, some type of bra on underneath my shirt. So they work. So, like I say, you have scarring, and a little bit of the sensitivity is gone. But other than that, I am just so happy. What I did was, since I wasn't publicly going around asking people how they look, I went to my gynecologist, and I showed her, since she looks at many women, and I asked, how does the breast reduction look? And she said, actually, they look better than most. They look pretty normal, and they look really good. So I got a little stamp of approval, and I was happy about that. As far as me gaining weight and if they got any bigger, no, not really. They've kind of stayed the same. Actually, I've lost weight. So they really stayed the same. I haven't had any problems with them at all. And so, I'm good with it. My shirts look so much better. My tank tops. Let me tell you, with big breasts, I would sweat all underneath my breasts. And, when you stretch your tank top out, you have these wet marks. Ugh, how embarrassing. I don't have that anymore, really, at all. So I'm happy about that. But what I really want to explain to you is, please do your research before you get your breast reduction. Please make sure your doctor is board certified. Make sure you see his before and after books. Make sure if there's patients that you know that he's had, ask them how their procedure went. Go online. I was a big research person. I went online. I looked at the doctor. I went under the complaints to find out if he had any issues, any complaints. You just want to check everything, because once it's done, and you can go back and try to reverse it, but who the hell wants to go back and do surgery again, and who wants to do recorrective surgery if you could fix it before you have the problem? So again, that's what I did. I just really researched my doctor to make sure that he did a very good job. Even if you have to sit in the waiting room of his lobby, ask his patients. I'm telling you, it is so well worth it. Because if you don't ask, you're not going to know, and you're going to be more nervous than you already are to get the surgery. So ask questions. My husband went in the doctor with me every time I went to the doctor for consultation for my breast. Because if I didn't have a question, he may throw up a question, but I wanted him to at least be there. So whatever the doctor said, my husband was able to absorb that information. So if anything went wrong, I had somebody in that room with me to know exactly what the doctor had said. So if you have anybody, make sure they go with you, and it's good for support too. Another thing is make sure you call your insurance company before you have the procedure done, so you can make sure that the insurance company will pay for it. My surgery was about $26,000. A lot of money, yes. I pretty much had to pay about $300 when it was all said and done, which is fabulous. Okay, however, I almost got stuck with that $26,000 bill, and I'm going to tell you why. Before you have your breast reduction, of course, you're going to call the doctor and go get a consultation, right? Okay, make sure you do everything in your power to just do the prior steps. So your insurance company doesn't come back to you and say, did you try anything else before you went under the knife? Because that's what they came back to me and said. And I said I went and I worked out at a gym. They almost wanted to see my gym records, which was fine because I had about a good year prior to going to the gym to show them that I was going like 4 or 5 times a week to try to lose weight to bring my breasts down. But it didn't work. It did a little bit, but I was talking about trying to bring some sizes down, not just one size or even a half a size. So I was going to the gym. Go to your weight loss doctor. Go to a chiropractor because, you know, chiropractors, they work on your neck, you know, and some people complain about your neck and your back. You know, show documents, get letters showing that, hey, I went to the chiropractor because my neck hurts all the time, my back hurts all the time. I went to my weight loss doctor. So, you know, they can see that you were just trying every means possible to try to lose weight. I even went to the spine doctor, and actually that was a letter that saved me because they were trying to stick me with this because I didn't do all that. You know, my insurance said they'll pay for it. Great. I went to the doctor to do my breast reduction. He did a consultation. He said, hey, you're a great candidate and I'll be happy to do it. And that's pretty much all what I needed, you know. But I did remember going to the spinal doctor prior because I felt like my spine was out of whack. You know, with heavy breasts, you feel like you're not sitting up straight. You just feel like you're a little crooked. And I went there to see if my spine was straight. He said, yes, however, I can see how your breasts will make you feel like that, and maybe you do need a reduction. So his words helped me out by saying that, and I was able to fax that letter, and boom, I got a letter in the mail saying it has been approved, and I was so happy because that was $26,000 wiped out. And I was so scared because I can't afford that. You know, I was happy that the breasts were getting done, but, you know, I don't want my credit to be all bad because of this breast reduction because I knew I wasn't going to pay no $26,000, especially when it was already done. Thank God everything, you know, worked out. So make sure you get all paperwork to document everything that you have tried. It really does help. So that's like one of the biggest tips that I can tell you, you know, what to do prior to actually going underneath the knife. So that's pretty much all I have to say about my breast reduction. I do love it. I am happy. And if you're considering it, thumbs up. It was the best decision that I could have possibly made. My clothes fit well. I'm just happy. You know, everything just fits, and, you know, they're not heavy and I'm not sweaty underneath all the time, and I just feel normal. Again, I'm only 5'2". You know, it was just way too much for me. I was just all breast. You know, back in high school, I was known as Big Titty Nicolette Toy. Now, I'm just Nicolette Toy. And there's a lot of other features that people can see me that they like rather than my big breasts. You know, people just don't look at me and talk to my breasts all the time like they used to. Now they actually look at me, and, you know, it's great. I still have breasts, and when I push them up, they look like I don't look like a boy. I look like I got breasts. You know, and I'm happy that my husband married me when I did have big breasts. And as you can see, I'll put like my wedding picture up, you can see. Look at how big those were, really. So as you can see, I needed a change. But he was so supportive, and I'm just happy that I had that support in my corner because he knew that it was just way too much, and it was painful for me. You know, when you have to come home every now and then and just lay on your back just to release the stress from your breasts, and you just want to lay on your back for a little bit, That's ridiculous. You know what I'm saying? But, you know, it's all good. But I just want to do this quick video and just tell you a little bit about the procedure that I went through and, you know, how I feel. And if you have any questions, please comment, reply back, email me, whatever you got to do. I'll definitely do my best to reply back and answer any questions that you may have. And that's pretty much all I got for you. But it was well worth it for me. All right. Thanks for listening. Bye.